Marijuana by Jasmine King. Marijuana is an herb that contains chemicals known as cannabinoids. A cannabinoid found within marijuana is called tetrahydrocannabinol, also known as THC. Cannabinoids affect the central nervous system. These chemicals work within the body by binding to specific sites within the brain and nerves in the nervous system. The strongest concentration of cannabinoids are found within the leaves and flower of the herb. Even though marijuana is considered the safest drug compared to the rest of illicit drugs, there are still damaging effects from marijuana that can take a toll on an individual's health. Some believe that marijuana is just as safe as alcohol. However, others stand to argue that marijuana does more harm and danger than just a regular buzz. There are four main ways of ingesting marijuana. It can be done through inhalation, oral, sublingual, and topical. Inhalation is the most popular way because smoking marijuana is the fastest way for an individual to react to it. Oral methods of marijuana can vary from edibles, capsules, oils, and tinctures. Marijuana can also enter the body by placing it directly under the tongue, where the blood vessels can take in cannabinoids through absorption. Marijuana can also be used topically in form of lotions, salves, bath salts, and oils applied to the skin. There are many physical effects from ingesting marijuana. It can vary from having bloodshot eyes, dry mouth, increased appetite and cravings, fast heart rates, coordination slowed, and heart and blood pressure problems. There are also effects on the mind. Researchers have noticed changes of blood flow within the brain for heavy marijuana smokers. They tend to have a different size and shaped thalamus, which affects the brain's involvement of consciousness and processing information. Smokers also tend to perform lower in memorization, score lower on tests, a decline in IQ, and struggle learning. It is common to also experience short-term memory problems, severe anxiety, paranoia, panic, hallucinations, psychosis, and loss of personal identity. Risk involve being more likely to be diagnosed with schizophrenia, especially if there has been cases within the family history. Heavy marijuana smokers develop changes within blood vessels that increase the risk of having a heart attack and stroke. Marijuana has been found to also be related to mental illnesses. It is common for marijuana to cause people to experience delusions, hallucinations, and a loss of sense with reality and one's self. Marijuana affects individuals socially. Social consequences from the use of marijuana can be negative by the disapproval from peers, lack of motivation in oneself, and the smell that comes from using marijuana. Legal consequences of being in possession of marijuana can lead to incarceration and a fine by federal laws. The first offense can lead to a 1-year incarceration with a $1,000 fine, and the second offense can lead to 2 years incarceration and a $2,500 fine. Every year, Americans spend $10.7 billion on prohibition. Marijuana has been widespread among many young people. Within the past year, there has been more than 11 million people ages 18 to 25 who has used marijuana. In 2015 alone, there were 1.4 million drug law violation arrests, and 84% of that were from being in possession of marijuana. And these are my references.